Hello everyone, I'm going to introduce a recent work published in the journal Phenotype titled Auxiliary Diagnosis of Papillary Thyroid Carcinoma based on the Spectral phenotype. In the current society, papillary thyroid carcinoma as the most common type of thyroid cancer accounts for 60 to 70% of all thyroid cancers. Although 10-year survival rate of PTC is over 90%, the patients still develop adverse symptoms. In the clinic, the complicated process and delayed diagnosis of thyroid cancer have also aggravated the burden of medical personnel and surgical patients. So how to diagnose papillary thyroid cancer quickly and accurately has become one of the current hotspots. Consecutively, in this study, we aim to build a spectral acquisition device to provide a feasible solution for optimizing the intraoperative diagnostic process of PTC. To clarify the spectral absorption characteristics of PTC and construct an interpretable diagnostic model based on the spectral phenotypes. This is the cell-filled spectral acquisition device used in the experiment, and the entire experiment can be divided into 4 steps: data acquisition, data processing, model construction, and model interpretation. Firstly, we utilize the spectral acquisition device to collect spectral data. Secondly, we apply pre-processing algorithm and algorithmic combinations to process the data. Thirdly, we filter the feature wavelengths using the selected CARS algorithm for building a detection model. Finally, we analyze the characteristic wavelengths and calculate the spectral correlation. We observed that the wavelengths after the first selection showed clustering characteristics and clustering at the spectrum peaks, and the model showed better performance under both MC and MC plus MSC pre-processing conditions. The experiment findings additionally revealed that the second selected wavelength selection effectively removed redundant information from consecutive wavelengths in the majority of pre-processing methods, thereby enhancing the model's performance. In the ultimate PTC detection model, the MC plus MSC model exhibited the most robust classification prediction performance. The discussion unveiled that within the optimal model, the MSC algorithm eradicates the spectral variations originating from different scattering levels among slides, cover slips, and samples. In the meanwhile, the MC algorithm accentuates data dissimilarity by eliminating extraneous information. Subsequently, in the spectral correlation plots, for the best performing PTC assay model, the selected wavelengths showed moderate correlation with the cell alignment and nucleus sizes respectively. Meanwhile, the maximum correlations were found at 208 nanometers and 219 nanometers, which are the absorption peak positions of most amino acids, phenylalanine and oxyhemoglobin, increasing the clinical interpretability and reliability of constructed models. In conclusion, this study developed a spectrometer-based detection device aimed at distinguishing PTC from normal thyroid tissue and aiding swift intraoperative PTC identification. The clinical interpretability of the model was highlighted by the occurrence of amino acid absorption peaks within the selected wavelength range. Moreover, the alignment of characteristics spectral with the thyroid-related hormone indices and microscopic image parameters underlined the robustness of the constructed model.